Josh, you are the co-host.
Recording in progress.
All righty.
Let me get
Hi, Jay. It's Tina from Arizona PBS. Can I have permission to record?
You sure can.
Thank you.
Anybody else here who would like the ability to record, just let me know. I'll be happy to do that. We do provide a copy after the press event is over. We'll give it one more minute. Okay, folks, we do not have David Thomas with us today. We will have, as we usually do, Josh LeBaer, beginning with some comments about trends in Arizona right now. And then we will open it up to questions from the group. So with that, the Executive Director of Arizona State University's Biodesign Institute, Dr. Joshua LeBaer.
Hi, good morning. Just give you a couple of quick updates on where things stand. I'm going to share my screen here. Just a couple of quick comments on that. So this is sort of the graph I've been using all along with us, sort of tracks, if you will, the rate of the illness in the state. And what we're seeing when the graph is headed downward, as it is now, that means that effectively the brakes have been put on and there is a day over day decreasing number of cases per day. And fortunately, we seem to be continuing in that general trend. For the first time in a long time now, we're below 1,000 new cases a day for our 7-day trailing average. And that continues to head in the direction that I'd like to see it head. Not quite as far down as we were when we were in September, but we're certainly headed in that direction. So that's overall good. The other quick trend I'm just going to mention is the what we call the S gene dropouts. And this is a measure, if you will, a little bit indirect of the UK variant that's in the population. And that one is going up. So if you can see this trend here, back in December and January, it was quite low. And now in the last number of weeks, you can see that the percent of cases that are positive due to this variant is going up, generally speaking. So we'll have to keep our eye on that, but it looks like that new variant is sort of taking hold in our state and may well do so in the weeks to come. So that pretty much summarizes, sort of the graphed trends here. Happy to talk about anything else that you may have observed. Vaccination is continuing apace. We're seeing, as you know, right now in the state, we're doing people who are 55 and older, but with a plan to get everybody on board by beginning of May. So I think that is all very good news. Roughly speaking, I think we could say that around 30%, maybe a little bit north of that, of the people in our state have either been infected at one point by the virus or have been vaccinated for the virus. So there still remains a sizable part of our population at risk for virus. So, roughly anywhere around 60% or so. So, or a little bit more than that. So we have to be, continued measures for precaution, continue wearing masks in public, still recommending all of those things, at least until we get to this herd immunity point, which looks like it's on track for sometime in July. That's what the numbers look like for that. Other than that, I think don't really have any specific comments, so I'll just open it up for questions here.
Okay. Thank you, sir. Questions?
I was sure I was going to get questions about vaccines and such, but it looks like I'm not going to get any today, huh?
Okay. If there are no questions, then we will wrap this and let everybody get back to their day.
I have a question. Sorry. So with this variant that's coming in, we see that our cases are decreasing, but this variant is also still taking hold. And I feel like we're not like talking about it as much. Like, is there something that we should be doing more against this variant?
You know, there's not necessarily anything we can do specifically against any particular variant. You know, I guess it's continuing what we're doing in the sense of, mask wearing in public, maintaining spacing, doing as much as you can outdoors, all those things. Limiting the spread is the best thing we can do. The more virus that's around, the more opportunity there is for not only this variant, but for even other variants to develop and cause issues. So, the concern about the UK variant, there are really two. One is that it's much more transmissible. And so when a more transmissible virus takes hold in the state, then it will increase the number of people we need to vaccinate in order to achieve herd immunity. And two, there is now evidence that the UK variant is somewhat more deadly. So getting the variant in the population is, there's always that concern. The good news is that all of the vaccines that are available to us in the United States work well against that variant. So if we get people vaccinated, they will be able to resist this variant. So that's of course good news. Certainly there are people who are still ill out there. The numbers are down, the hospitals look much better, but there are plenty of patients still in the hospital with this disease. And for some people, it lingers a long time.
And I have another quick question. So there's been some talk kind of globally about in certain countries, they stopped the use of the AstraZeneca vaccine because of blood clots, but they're not really finding a relation in between like the blood clots and the vaccine itself. Do you have any thoughts on that?
Sure. Yeah. So the observation was there were I think 4 cases in Norway maybe, and maybe a case in Denmark and a case in Italy. Altogether, there was a handful of cases of people who had blood clots, some of them severe and some of them, a couple of people even died. Now, you have to remember that blood clots happen in the normal population all the time. Around 500,000 blood clots happen every year in the United States, many of them very severe. And that's, those numbers well precede, the onset of COVID-19. If you do the math, what that would mean is that in the United States, on average, you would expect, roughly 10 to 20 cases a week of people with blood clots who got vaccinated, just because of the prevalence of blood clots. So the fact that there are blood clots in people who got vaccines does not mean that those blood clots resulted from the vaccine. Many of those blood clots may have occurred on their own. What we would look for is a higher number than 10 to 20 blood clots per week in vaccinated people, something that looked like it was more than what we would expect by the math alone. And so far, we have not seen that in the United States, and it's not clear that they have seen that for AstraZeneca. In my own view, one thing that you have to pay attention to is that we know that among people who get COVID-19, approximately 2% of them will die from COVID-19. So considering the millions of people that exist in, the people that live in Europe, and many of whom are susceptible still to COVID-19, not vaccinating them runs the risk that they could still get infected, and some fraction of them, 2% roughly, will end up very ill or dying. So, you always have to weigh these risks from side to side. I mean, hopefully they will be able to quickly evaluate whether or not these blood clots resulted from the vaccine. You always have to take those things seriously. You never know. But hopefully they'll resolve that quickly, because getting people vaccinated is really the highest priority here, just because, without a doubt, COVID-19 is the leading, a leading killer, certainly the leading killer in the United States and in Arizona, and I suspect also in Europe as well.
Thank you. And you touched a little bit about this earlier about how we still have to like maintain all of these safety protocols, but the president said that, by July 4th, we should, be able to get in our backyards and, have a barbecue. Is that something that you think is something that can happen?
Yeah, I fully agree with President Biden on that. I think, what we know is that the vaccines are remarkably effective, and certainly in the vaccines available to us in the United States. The track record is excellent among people who've been vaccinated. To my knowledge, there are no reported deaths due to COVID-19 if people have been fully vaccinated. So it really protects people against severe illness. And if we continue on the path we're on now of this sort of high rate of vaccination, a couple million a day now, we should have a good fraction of the country covered by July, and we should reach herd immunity. And, already the CDC has released guidelines that say that people who are fully vaccinated should be able to hang out together with people who are fully vaccinated, even indoors, without masks. So as we get more and more of the population vaccinated, the freedom to do things will go up considerably. Right now, the reason we're masking is just to protect those people who are not yet vaccinated, which is still a sizable, the majority of our country is still not yet vaccinated, and we don't want them to get the illness because they still remain at risk of severe outcome. But once we get people vaccinated, once we achieve that herd immunity, I think we should be able to do that outdoors or even indoors in July.
Thank you so much.
Hi, Dr. Libera. This is Allison Steinbach from the Arizona Republic. Just another question about variants. So the state announced Friday a couple of cases of the variant first identified in Brazil. Is that a concern? And has ASU sort of done any research on how it may have gotten here or if it's spreading here?
We are doing more sequencing. I'm not aware of any more cases than the couple that were announced already. It is clearly not a predominant strain in Arizona right now. It's another one of these more transmissible variants, so it's something to keep an eye on. I think it looks to me like the UK variant is more likely to take hold here as the dominant variant, but we'll have to keep an eye on. We are increasing our surveillance sequencing now at ASU, and hopefully we'll start getting those numbers out. There's a cumulative website that TGen has put out, which I think is excellent. So I would take a look at that. They sort of summarize all the variants available in the state. So we'll have to just kind of watch.
Got it. And for the UK variant, it's not predominant yet, but what are you sort of expecting to come?
Well, the numbers are definitely rising. There are days when it's 20% of all the positives. Now, keep in mind, the number of positives right now is relatively low, but the fact that it can achieve 20% of positives when a month ago it was, almost not available, suggests to me that it is among the people where it's spreading, it's one of the more predominant strains. And I would not be surprised if in another month or two, that number doesn't become the predominant strain in the state. We're going to have to get our modeling team to, do a logarithm of the curve of the data and see if it's on a linear, forms a line, which would be an indicator of exponential growth. So we should take a look at that.
Great, thank you.
Yep.
Dr. LeBert, Garrett with ABC 15. Wait, I'm sorry, I thought I was muted for a second. Can you hear me?
Yep.
Okay, sorry about that. I'm going to ask you to speculate for just one moment. Now, with your discussion on the variants, with it being 1 in 5 of your tests, and obviously showing that it's taking some sort of hold in Arizona, our case numbers continue to drop. Our hospitalizations it appears indicating that we're hitting a floor with hospitalizations. The decline is coming much slower. If the UK variant is to start impacting the case numbers, would that in turn impact the hospitalization numbers, or are we looking at trends essentially that would mirror in January, or would we sort of see a divergence in the trends where we would see possibly case numbers going up but hospitalizations and deaths not going up at the same rates?
Right. Projecting the future is trickier now than it's ever been. What we've seen in the past, to start with that, is that we would get these really high, surges of cases, and then they would come way down to, relatively low numbers, and then numbers would start to trickle back up again, right? Because, either people relaxed their behaviors or they started to interact more or whatnot, and so there was more spread. So there is the chance that we could start to see something like that again, that people seeing the numbers are low decide that we don't need to wear masks anymore. And of course, they're hearing the news that there's a lot of vaccination going on, decide they don't need to wear masks anymore. And we could start to see rising numbers. And certainly with the growing prevalence of this UK variant, which spreads much more quickly than the historical variant, that would also surge. Now, counteracting that are two factors. One, a lot of the people who tended to be more relaxed about their behavior have already been infected now. The people who have not been infected now are largely a population of people who've been extraordinarily careful to avoid it so far, and presumably they will continue being careful, and so they may not be at risk. Also counteracting that possible resurgence is the fact that we are vaccinating more people, and specifically people at high risk of bad outcome. So the hope would be that by focusing on the 65-year-olds and now the 55-year-olds, we will start to hit a lot of people who might have gotten ill, or severely ill, I should say. And so we may see, while we might see more spread of virus, we might not see as much hospitalization from that population. Of course, still more complicated is the fact that, unlike heart disease and cancer, COVID-19 does in fact hit middle-aged people and younger people. A quarter of the people who died in this past year have been people who are middle-aged and younger. So young people do still get it, and sometimes get really severe cases of it. So it's very complicated. So asking for speculation, I would say we might begin to see another surge start to emerge here. I don't think it will be as severe as the last one because of all these other factors that are kind of pushing back against severe outcomes.
Perfect. Thank you so much.
Any others? Okay.
All righty.
Thank you all very much, Josh. Thank you.
All right. Thanks, everybody.
Any follow-up you have, you can feel free to reach out to me or to Sandra Leander. Thank you.
All right. Take care, everybody.